Hi, I'm Dr. Nina Woulff, and I'm happy to introduce you to one of the excellent associate therapists in my practice, Pam Roberts, who will be telling you about her work with both individuals and couples.
My name is Pam Roberts, and I am a registered social work therapist, and I have been doing therapy since 2002. I see people age 19 and older for a variety of different reasons. These include, but aren't necessarily limited to, anxiety, depression, grief and loss, trauma, relationship difficulties, low self-confidence, and I also do family and couples therapy. So people often consult with me when they're looking for skills or techniques to help them manage a problem more effectively. Other people are more looking for a safe place to talk or process something that has happened to them or maybe is happening to them right now. And then other people are looking for kind of a combination of those two things. In individual work, I typically use acceptance and commitment therapy, which is also known as ACT. And in my couples work, I have an interest in this field and have extensive training through the Gottman Institute. The Gottman Institute was founded by Dr. John Gottman and his partner Julie, where they've done about 40 years of research on what makes couples succeed or fail. So you can read about the different models of therapy that I do on our website. But I think more importantly is what makes or breaks therapy is the strength of the therapeutic relationship. That's the relationship between me and the person consulting with me. And I think I have the ability to make people feel really comfortable and safe and respected in session with me. And I do know that I have some expertise in the problems that people come to consult with me about, but I'm also very aware people have their own expertise about their own lives and what it's like to live in those. And so it's through that collaboration between those knowledges that will determine what we do in therapy and how to make it most effective. So I think I'm pretty down to earth, and I also like to use a sense of humor when it's appropriate. I grew up knowing I wanted to work in a helping profession. And in my job, I get to meet really interesting people every day who share with me really interesting stories, some of struggle and some of triumph. And I'm really honored that people, often when they're struggling the most, will share that with me and let me help them on their journey towards wellness. So even being a small part of someone's journey is something I'm eternally grateful for, and I feel very fortunate that this is what I get to do for a living.